Yep, we are live and we are recording.
Perfect. So good evening and welcome to the Council for Minnesotans of African Heritage council meeting. I am Chair Hughes and we are going to officially call it to order. If we can have one of the CMAH staff do the roll call.
Sure, I can do it. Chair
Perfect.
Hughes?
Present.
Vice Chair Doe?
Present.
Councilmember Lundstedt?
Present.
Councilmember Adams Lee?
Present.
Councilmember Mullins is present. Councilmember Nandi?
Present.
All right, that looks to be all the council members that are present.
Perfect. Thank you. And I know we have one council member that was excused and not sure about the others. Hopefully they'll be joining us soon. So if we could just go straight into adopting the meeting agenda. I don't believe that there are any additions or corrections to that. So if I can have a motion to adopt the meeting agenda.
So moved.
Second.
Second.
Perfect. All in favor?
Aye.
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 All right, motion carries. And so we want to move to the consent agenda. There's only one item on the consent agenda, which is the meeting minutes. Hopefully everybody had a chance to read through the minutes. After you have read them, were there any corrections or additions that we need to make to the meeting minutes?
No, Madam Chair, please let the record reflect that Councilor Crawford is here.
Thank you. And hearing none, if I can have a motion to approve the meeting minutes from September's council meeting.
So moved, Crawford.
Thank you. Is there a second?
Second. Hollis.
Thank you. Thank you. All in favor?
Aye.
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 Any opposed? Any abstentions? Motion carries. So if we could move to our financial report. Oh, we're cooking with grease here on this call here. Shakir, if you can go over the financials, because I do not believe Alfreda is on yet.
So for our financial report, as you can see, we don't have any negatives, nothing's been overexpended. We're just still doing our typical monthly payments. So that's going to be our minute payment, our utility payment, and our communications payments have gone through. No major contracts, nothing big has gone through, just business as usual. The only thing that I want to highlight is just on page 2 of this, you'll see that the professional talked about outside windows is at $5,000. That is our grant from the Minnesota Historical Society. It's reflected $5,000 right now instead of $10,000 because the PO from last fiscal year was just closed. We didn't use any of that money, so that will be refunded back. So for next month, you'll see this at $10,000 instead of at $5,000.
Perfect. Any questions? We know that, this for the council, we're not really program heavy. So you are typically going to see more expenditures from salaries versus, other aspects of it. And then our typical minute communications, so stuff like that. But I didn't know if there were any specific questions that anyone had in reference to what we're seeing. All right, you can stop sharing, Shakira. Thank you. And I'm going to move us over to our special guest. So we have Commissioner Herke from the Minnesota Department of Veterans Affairs. And we also have David, is it Divley or Dively? I'm sure I'm messing up your last name and I apologize. for the Minnesota Council on Disability. So I'm going to turn it over to Commissioner Herke if you are available. I see you're on.
I think we got, can you see my slides?
Yes, we can.
All right, I'm gonna try to blow it up here just a little bit if I can. There we go. All right, and good evening, and thank you very much for having me as part of your program tonight. I appreciate the opportunity to tell about the veterans in Minnesota. I hope you'll find this both informative and give you a little insight into what activities Minnesota Department of Veterans Affairs does on behalf of the veterans of Minnesota. And with that, this is sort of the overview that I got for tonight. Of course, it wouldn't be a brief at the government level without a mission statement and vision. And I'll go through our strategic goals quickly. We have two focus areas, programs and services and healthcare. And then priority initiatives at the end. I just want to highlight those as it relates to things that are really a focus for us here in the agency. I did want to say that although you see some of the locations of some of the facilities I'll talk about, we actually are located in 55 facilities through our locations throughout Minnesota. Much of that's done through our outreach, which is at the universities and at the clinics and the VA hospitals throughout Minnesota. Our mission statement is to serve the Minnesota veterans, their dependents, and survivors. We connect them with federal and state benefits and care that they have earned, and that's probably an important word there, is earned. Many times you'll find that especially older veterans think that they don't really deserve care or benefits. They might only serve for a short amount of time, and they say that's for others. The message I always carry is if you've served, if you put up your right hand, sworn an oath to your country and served time, you have earned benefits and the ability or access to care. So that's sort of the message I try to carry, and I try to make sure that both veterans and families of veterans understand that. We fulfill the mission, of course, through finding innovative programs and services, and we always try to improve the quality of life of the veterans we serve in Minnesota. A couple items here. Then our strategic goals. We came up with a new strategic plan. We have 4 areas of focus. One was a continuum of support, which we'll find is veterans at different points in their lives have different needs. And a lot of times when they're being discharged from the military, one of their initial needs are potentially housing or employment. And we see a lot of that to begin with. As a person goes through their life, those needs change. So our intent here is to make sure that we're seeing all the requirements of the veteran throughout the entire time post-service. We found that awareness of what we do in Minnesota Department of Veterans Affairs and the federal VA is still lacking amongst veterans and veterans' families. So that was an area of focus for us. In the area of resources, we're looking at both the physical resources and also stewards of funding our fiscal resources. So we've done a lot in the area of sustainability for our agency to be more sustainable, to cut operating costs. And we're continuing to look for operational savings wherever we can find them. And the last one, and probably the one I spend the most time on recently, is developing and sustaining the workforce. As you know, the labor market is tight, and we're always looking for additional people, especially in the healthcare area. We're finding it very difficult to attract new talent in that area due to the demands placed on them by COVID and other items. But those are our 4 focus areas for our strategic plan for our agency. I did want to provide a little bit of demographics. This is a new number. In fact, this is the first time I briefed 304,000. Previous to this, last year we were at 312,000. So we've been losing about 5,000 to 8,000 veterans per year. In Minnesota, those veterans still indicate or make up about 6% of the state population, and especially people over 65 see a great concentration of veterans in those that are over 65. We have veterans that have served from all 87 counties, of course, and we have 43,000 veterans that have served since 9/11. As you can see there by race, white veterans are the biggest group, but after that, African American is the second largest group. About 3 of every 4 of our veterans have served during a wartime period. I think that's sort of interesting. And then the largest group of veterans today with us is the Vietnam veterans at about 110,000. Next, I'd like to talk a little bit about one of our 2 divisions, and that is the Programs and Services Division. This division in general helps assist veterans and their families obtaining both state and federal benefits. So we are not just focused on those benefits that we provide, but we also help the veterans and their families to get those federal benefits that they've earned. We administer several different programs, and again, many of those are as a veteran, you can be eligible, or dependents or survivors for many of the programs. I'll talk a little bit about those here. We have federal claims assistance folks located both in St. Paul and Fargo. We're at the Whipple building in St. Paul, and we actually represent veterans on behalf of them in front of the federal VA. And we advocate for them. We help them with claims, help them with if they get denied, we help them with their request for reconsideration. We also help them in front of VA judges that come. They used to travel, now it's done virtually. We have a field and tribal operations as sort of the outreach group of programs and services. And again, they're located in many different locations. We do have 1 representative for each of the 11 tribes in Minnesota. And then we also have a women's veteran program. Women are becoming a larger part of the veteran population in Minnesota right now. I think they're a little over 7%. And I know on active duty now, the newest numbers I saw, for at least the Army, was they represent about 16% of the active duty. For higher education programs, we support veterans with at college and universities, a lot of times using their federal benefits. We do have on-campus resource centers that we actually man and operate. And then we help provide veterans with the support that they need while on campus. And a lot of times that's, again, just getting payments maybe from the federal VA to help with their tuition. We do have a unique program in Minnesota. Besides the federal GI Bill, there's a Minnesota GI Bill. It's a lifetime eligibility for $10,000. It can be used along with your federal benefits. And it doesn't have to be post-secondary education. It can be on-the-job training, apprenticeships, licenses, and certifications are also eligible for that funding. And again, that's unique to Minnesota. We also run the state approving agency, which is, again, helping both with the state statutes and federal regulations to make sure that who is eligible for what particular funding and assistance. So we do that. That's sort of a certification that we get from the federal VA. We have right now, I think, 785 apprenticeships going on as we speak, and we help set those up, get the different companies to work with, and help get veterans into those apprenticeships. And I'm pretty proud of that, that we continue to have about that same number each year that go through the different programs. Some of these programs are several years in length or duration. And then we're also my office is responsible for the Veterans Preference Act, which is state granted preference rights, primarily focused on municipal and county, state. A lot of times when a person's been dismissed, to make sure that's been done appropriately and so forth, there are some rights that veterans have that are special in that area, and we are the last word after the administrative law judge has provided their ruling. A unique program that's been going on, probably the longest program, even longer than my agency, was the State Soldiers Assistance Program. And this is a direct support in usually paying for some type of financial assistance. It could be a situation where it's maybe a furnace went out, a low-income family that needs help and assistance, and this would be catastrophic. And this funding is available. It's about $6 million that I get per biennium to provide this direct assistance. And we did do a similar program for COVID where we had $6.2 million actually provided to those families that had lost income due to COVID. And we just wrapped up that program, of course, with the last biennium, but it was very successful, and we were able to help over 4,000 veterans to provide gaps for both loss of income and also special needs grants for those that had emergency situations that needed help or support. We have a unique call line that we work through the Lutheran Social Services contract, and that's 1-888-LINK-VET, and the link line is open to both veterans, their family members, and it can assist them with any issue that they might have to sort of put them in the right direction. I think they have over 2,000 frequently asked questions that they've developed over time, and that phone line is mostly during the daytime. It does go into the evenings, but it is 7 days a week, so it's not a 24/7, but it is available. And through the LINK-VET, we can actually assist and help to push you to the right direction to get additional care or assistance. We do a lot of mental health through LINK-VET for family members of veterans. That's probably one of the biggest areas that we help with as veterans go off to serve, or if they're in the National Guard or whatever it might be. A lot of times the families need help and assistance, and we're there with this call line to be able to help them. The cemeteries, we have 3 current cemeteries. These are open for veterans and their spouses. They're located at Little Falls, Preston, Duluth. We have a groundbreaking tomorrow that I'm going to for Redwood Falls, which will be a new cemetery there. These are state cemeteries provided by the federal VA through a grants program. And we actually do the burials, line everything up, and assist for veterans. The burial is free of charge for a spouse. That there's a fee associated with, but it's quite reasonable. We also have a grants program that we are responsible for. We give grants to the 4 categories shown here. They're veteran service organizations like the Legion. We also give grants to each one of the 87 counties for the county veteran service officer. We have a special grant for the Minnesota Assistance Council for Veterans who help with homelessness. And then any organization or foundation can put in for support our troops grants. I think you have to be a 501(c) in order to apply, but those are grants that support veterans through the use of the money from the license plates that people have purchased. Our second area is our healthcare division. Today we have 5 veterans homes. They're located throughout Minnesota at Fergus Falls, Hastings, Laverne. The biggest one is at Minneapolis and then Silver Bay. We have 3 new ones opening up. This is unique. I think we're the only state I can find that has got funded for 3 new veterans homes. They're going to be in Bemidji, Montevideo, and Preston. And we are looking for both employment there, as it says, and also for admissions. So if you know someone that's interested, either employment in those areas or admissions, we can help at the websites provided. We provide 24-hour skilled care in 4 of the locations, and domiciliary care, also known as board and care, at our location in Hastings. And we serve, it says 700 veterans. It's closer to 800 veterans actually that we serve in those locations. And we consistently have really high scores as it relates to our quality of care. Here's pictures. So you can see Minneapolis has about 300 veterans in that location. Silver Bay is one of the smaller ones. We're in the 80s there. Laverne is about 90 something. Fergus Falls is just over 100. And Hastings has 144. I just got done doing a briefing on Hastings, so 144 veterans currently at Hastings. I'm not going to go through each one of these, but you can see that we do dementia care. We have rehabilitative services. We work on nutrition. So everything you'd find in a normal nursing home plus more probably. We have our own pharmacy, so we can actually distribute out of central pharmacy at each location. And then we do work like drug and alcohol treatment for those that need it. And of course, we have volunteer programs for people that like to volunteer at the homes. And I got, I think, 2 priority initiatives I'd like to talk about. The first one is ending homelessness. And I did put a graph in there that demonstrates by race the number of homeless veterans. Right today, we have 280 veterans that are on the Veterans Registry for the state. We actually are responsible for maintaining the registry, and this number of veterans has come down. When we first started, we were almost 700 veterans. Of course, we have a lot of turnover in those numbers, but we had a bit of a surge through COVID, went over 300, and now back down below 300 at this point. Like I said, we run the registry, but we have 55 partners that work with us at the local and state level, to include other state agencies like the Department of Housing and also Human Services and Health. And we placed in just over the last year about 550 veterans into safe, secure housing throughout Minnesota. And today there's 10 continuums of care within Minnesota. Right now, 6 of them have declared functional 0. And we have another one that'll be declaring here probably in the next month or so in the St. Cloud area, the central COC. And we're really focusing our last efforts on Hennepin County, Ramsey County, and St. Louis County and up near Duluth. And the other area that we just started getting into through a program allowed by the legislature is veteran suicide prevention. Each year we lose between 100 and 130, I think the highest year was 134 veterans that die by suicide. And our focus is to prevent those deaths and we'd like to eliminate them. But our interim goal here is to reduce by 20% by 2025. We did receive $1.65 million support a statewide initiative for veteran suicide prevention over the next biennium. And we've worked with the federal VA as it relates to developing a program which will have 3 different focus areas. And we're starting to initiate that. We just got our suicide prevention coordinator brought on in the last 2 weeks. So we're looking to move forward quickly in there and to reduce and finally eliminate the number of veteran suicides. I forgot to mention, I'll go back one here. In the ending veterans homelessness. We want to be the 4th state to declare functional zero for veterans homelessness. And that's the governor's intent. And we're working towards that intent today. We think we have the funding to do it. Right now, our biggest challenge, and if you have any landlords, you could send my direction. I would be interested in being able to pick up veterans that have a few, one or more barriers. I'd be more than welcome to sit down with them and spend some time to discuss the program we have and what we can do to help those veterans out and what we could do together. So looking for more housing rental units, especially in Ramsey and Hennepin County.
So Commissioner, can I just ask a question?
Sure, that's the last slide right
Oh,
there.
is it?
Confidential information. All right, Chair.
So the question I had, and I think you kind of answered it, but if you go back to the homeless slide, I'm just curious, has it been identified, like I see you've identified it by race, but when when we're looking at this, of course, this is talking about across the state of Minnesota. So is there a more prominent area where you're seeing a higher rate of homelessness versus, is it more of the Twin Cities? Is it greater Minnesota? Or have you all been able to pinpoint that?
Yeah, it's actually for veterans, like I said, there's 10 continuums or regions in Minnesota, and seven of them are already at functional zero. So we're placing people. It's not that we won't have someone that's homeless, like in the southeast area, but within 90 days we can get them into a rental unit. And we're able to move people quickly. The problem areas I have still are Hennepin County, Ramsey County, and St. Louis County. Those are the 3 areas that I'm focusing in on. And I can tell you the legislature's been wonderful to us. They gave me over $6 million to help with rental assistance and also with wraparound services. So I'm ready to take care of anybody that's a veteran can get that same care from the federal VA or those vouchers. And now at the state level, I'll be able to help those people that maybe had a bad discharge, or maybe they didn't serve enough days to be a veteran in the federal eyes, but that to me they're still a veteran. They're a prior service member that served. So I feel obligated to take care of them, and that's what the HUD believes the same way as far as our responsibility for reporting. So we're going to take care of all of them. We're going to pick them up, and we're going to find places for them to live, and we're going to solve this problem so that we don't have to deal with it. It's been going on at the federal level since 2005. A very, very intense focus, and since 2014 or 2010, we've been focusing on it in the state of Minnesota.
Okay, thank you.
Other questions? Probably should go to the end here. There we go.
So any questions from council members? I see Council Member Crawford just said, thank you for your service and the ongoing work to support veterans. He made a comment that his father was a veteran.
Excellent.
Any questions from the council members in reference to what Commissioner Herke had presented?
Well, they're thinking, I probably didn't say that. I served actually 31 years in the Army.
Oh, thank you for your
service. Came to the state of Minnesota after retiring in 2016. So
nice. But I guess the question I'll have while they're thinking is, where do you see that your agency and our agency can potentially partner?
I guess I was thinking about that as I was preparing the briefing slides, and the homeless area is really one of my biggest concerns, and with being the population being so high with the African American, I see that as an area that you could really help us with, and especially finding the housing. Like I said, I've solved almost every other problem. I've got assurances for the landlords as it relates to if there's damage to the home. If they're willing to take on a person, I can get them an incentive. I can hold an apartment. If there's an apartment open for a period of time, I can pay for the that interim period for the landlords. I just got to find more landlords right now. I need, they've told me I need I usually have about 540 units per year. In order to get to functional zero by January 2023, I'm going to need about 880 units total. And that's a lot of units. I got to generate 330 more than usual. And most of those, again, are in Hennepin County and also in Ramsey County.
Perfect. I would say, Linda, if you want to, I know you're typing, you want to just unmute and talk.
Hello.
Hello.
I'm not. I'm Linda Sloan. I'm the executive director for the council, and I would love to follow up with you regarding that homeless issue and see if there's anything that we can do, whether it's promote the work that you're doing, try to make some connections. But I mean, you have resources, and we have a lot of African heritage people out there on the street. And so we definitely need to help facilitate a connection.
That would be great. Thank you, Linda.
You're welcome.
Any other questions from council members?
Madam Chair, this is.
Oh, go ahead, Carl.
Question. Are you having a hard time hearing me?
Okay, now so you sound a little bit stronger now. Go ahead.
Okay, one question is legal support for veterans that may find themselves in trouble with the law, either due to homelessness and sometimes mental health or drug addiction. Is there support? I'm in Duluth, Minnesota. Is there support locally for veterans that may find themselves on the other side of the law? Thank you.
There is, that was Carl that was speaking, I think. Yeah. Carl, there is actually in Duluth, there's the Minnesota Action Council for Veterans, which provides direct legal assistance to veterans that need help. Usually it's to clear something as it relates to homelessness, but they help in all different areas to assist and, to get your credit back where it needs to be or whatever needs to be addressed. That was one of those grants that I mentioned that is sort of a pass-through grant for us. But the reason we do that is so that they provide those services. And for addiction services, those can be picked up through the federal VA. And if the person is not eligible there, I can help them through that LinkVet program that we talked about. I can get counseling services and help and assistance for both the veteran's spouse, and also for the veterans, even the veterans' children in their family. So, yes, we do have ways of doing both of those items you asked about.
Excellent, thank you. I've worked very closely with MACV here in Duluth. Great organization.
Yes, they are. Very proud of them.
Any other questions? Well, Commissioner, thank you so much, because you did not have to spend your evening giving a presentation at the end of the day. And so we definitely appreciate, you bringing the information to the council, and then looking forward to just how we can help and partner with your agency and with the council. So thank you so much.
All right. Thank you, Madam Chair, and thank you, Council. I appreciate it. And Linda, we'll be in touch. Have a good night.
You too.
All right. Bye-bye.
Bye-bye. So, David, you are up.
Hello, Madam Chair and council members, and Linda. It's great to see all of you. Thank you for inviting me. Just a real quick check. Is everyone able to see me and hear me? Everything looking okay or sounding okay? Perfect. Yep. Okay. I'm going to ask that just if we do any Q&A at the end, which is perfectly fine, please just state your name for me so that the captioning can pick up who you are, and then I'll know who's speaking. So I'll just begin. This is really kind of cool because Linda and I both kind of came onto the state within a couple months of each other, and so we're both new-ish, let's say, well, I mean not so much to the state, but to being in a council and in our particular positions. So it's neat to come and visit, but it's also National Disability Employment Awareness Month, which is a really neat thing for us. And just to kind of lay it out in kind of broad numbers here, in Minnesota, there's about 4, give or take a couple points every year, 4% unemployment rate. There's about 20% unemployment rate for people with disabilities. And then that's all inclusive of any kind of disability. And if you look at folks who have intellectual or developmental disabilities, it's about 50% unemployment rate. That's of course the working age group, doesn't include seniors or youth. So there is a big need, and while we don't look at it this way, like folks with disabilities should be last resort, what we do see is that there is a little bit more attention paid to folks with disabilities with labor shortages, and we don't want that the group that we serve and that I'm a part of to be considered an afterthought or a backup for companies or for the economy. We are starting to see some interest growing in that area, which is good, regardless of the motivation behind it, I suppose. So I'll just kind of start up by just naming that, and that we're working with the Department of Employment and Economic Development to promote disability inclusive work environments, whether they're nonprofits, for-profits, and then, of course, our own state government. Our own state government does not do a good job. About half of all employees who are hired with a disability in the state of Minnesota as a state employee leave within a year. So, which is significantly worse than folks who do not have a disability. And right now, about 8% of the workforce has a disability. That's an improvement from what used to be around 2 to 4% 10 to 15 years ago. Depends on when you count exactly. So this month being a Disability Employment Awareness Month is a big deal for us. And so I'm happy to be here and share some information. But I'll also go into a little bit about what we do in general at the council. So in a lot of ways, honestly, our council on disability is similar in structure, I mean, to CMAH. And we have some similar legislative independence. We are not a part of the Legislative Coordinating Commission, the LCC, but in many other ways, we're structured the same way with a board, an executive director, and then staff that work with me, or in Linda's case, with Linda. And I've had the opportunity, and my staff have had the opportunity working with some of the staff here at CMAH, and always look forward to that and enjoy that. So thank you for those opportunities, Linda. So on to the council. So we're about 40 years, I guess now it's getting close to 50 years old. And our goal is so that there's a barrier-free Minnesota for every person with a disability to all aspects of life. So it's from, birth and early childhood education through school-age care to transitioning to adulthood to kind of those employment years of life, all the way to healthy aging. So it's kind of that whole gamut of life. And that's not that different than the charge that CMAH has representing African heritage. We kind of wear a few different hats, and I kind of explain it as like 4 buckets. So one of them is a technical assistance hat, so to speak. And there's lots of disability laws. Some of them are state, some of them are federal. And sometimes folks just need to call someone and talk to them about it and say, what are my obligations? Maybe I'm an employer, or I'm a landlord, for example. Or maybe I'm a person with a disability and I want to know what my rights are at the workplace or at my home or something. So, or even the legislature, I have a constituent that has an issue, and what can we do to help them? Is what they're saying true? Just technical assistance. We're not really wearing our kind of advocacy hat, if you will. We're just trying to explain to them what the laws are in place. Then we have our kind of policy advisor advocacy hat that we wear. And sometimes they overlap a little bit, but we do bring in a legislative agenda every year, and we'll continue to do that this year. There's a healthy surplus, it looks like, along with some one-time funding from the legislature. So we'll be working on a hopefully robust legislative agenda that we'll be bringing to our council, well, I guess actually tomorrow, for initial draft review, and then later as things settle in to get further solidified. But we serve as a policy advisor in many ways. So, for example, with COVID-19, we worked with the Department of Public Safety and the Emergency Operations Center as part of the incident command structure to ensure that when they built, for example, the State Fair testing center, or when they decide executive orders, that they're not inadvertently hurting folks with disabilities, but also ensuring that they understand how decisions they make impact people with disabilities. So we had one person that was basically deployed to work during that emergency, also with civil unrest. There's a huge overlap when it comes to civil unrest between communities of color and people with disabilities. Both are exponentially more likely to have a negative escalated encounter with law enforcement. And so police officer standard training issues are highly relevant to deaf individuals, blind individuals, people with autism are significantly more likely than other kinds of people with disabilities to have an escalated, what we would consider to be unnecessarily escalated encounter with law enforcement. And when you're a person of color who also has a disability, it's compounded even worse. So there's a lot of intersectionality between communities of color and people with disabilities, including the fact that communities of color are more likely, or people of color are more likely to have a disability. So it's really quite striking. So our policy advisor hat can be advising the governor's office on work where they, that we think they should be doing, direct lobbying and legislative work, that sort of thing. We also do training, community outreach, get out the vote, help folks get registered to vote, that sort of thing. So in a lot of ways, that's a little bit similar to the work that you all do. We do a lot of civil rights issues, building code. Americans with Disabilities Act, of course, is a landmark civil rights law that is very important to us. So we work in that area. But we also have a lot of issues around service animals and emotional support animals, service dogs. Disability parking is one of the most frequent things we get phone calls about, and service animals. And we also do training for local units of government, like counties and cities, about disability etiquette, disability awareness. We also view it from a cultural, social identity model and not just as a diagnosis. So a lot of people think of people with disabilities as kind of one group. In reality, they're dozens of smaller groups that have their own language sometimes, that have their own culture, that have their own norms and standards and practices and different values, different complex health conditions. So we really have to, we're responsible to essentially represent and engage and advocate on behalf of all of them and protecting all of their civil rights. We also do some work on emergency preparedness. So whether it was Katrina or 9/11, a lot of the people who passed away in those emergencies were people with disabilities. For example, in 9/11, they were not able to get down the stairs fast enough was a common issue, people who are wheelchair users. So we do a lot of work with emergency preparedness, ensuring people have a go bag or are equipped and have a plan. So we work a little bit with public safety on that. We do things with employment, and transportation is a serious, big issue for us. So those are some of the areas where we do policy advocacy work. And then we kind of do this fourth bucket. So we have technical assistance, we do advocacy work, we do training, and then the fourth one that we do is around several code areas. So building code, workers' compensation code, if you're injured, apologies for my excited dog in the background. Workers' compensation code, if you're permanently disabled because of a workplace injury, we're involved in all of those insurance claims to make sure people get what they need to live independently in their home. And the best way I can explain it is if you kind of consider all that we do is how can we get folks with disabilities integrated into the communities that they want to live in, work in, competitive integrated employment, where they want to live, love, and have life with whomever they want to, be protected from discrimination, whether it's for housing, for being an adoptive parent, which is legal to discriminate against people with disabilities, to not let them adopt, to where they live, to where they work, to where they get medical treatment. So that's basically, to sum it up, is we want that barrier-free life for people of their own choosing. Minnesota has had a horrible history of institutionalizing people with disabilities that did not need to be institutionalized into state hospitals and keeping them restrained and bound for days at a time without letting them get up or walk or eat or sleep or use the restroom or hygiene, things like that. So there was significant court cases that have led the state to have to reform how it operates. And only recently was let go of court jurisdiction over the Department of Human Services. So we kind of have to be a watchdog in one way, and then also a collaborative partner on other days across different committees that we serve on, which I know you all can relate to on your side, where we have to advocate and kind of also dance and then be nice partners in other environments and kind of go back and forth. And then I'll just add a couple of interesting things specific to Minnesota that you all might find interesting. So, for example, while African Americans or Black Minnesotans, so this is just Minnesota, is about 6 to 7% of Minnesota's population, but they are almost 18% of the people who participate in the state's long-term service supports for people with disabilities. So it's almost 3 times as likely. American Indians are twice as likely. Asian Pacific Islanders are more likely, but none of them are as significant as the African heritage demographic. While the white community makes up about 80% of Minnesota, but is actually underrepresented at only about 60% of service recipients. So just kind of reinforcing that communities of color are more likely to need and receive services because they have a disability. And those are those long-term care services. For services that are part of the community, integrated into your community, they are very similar, where communities of color are also overly represented. So for example, they make up about 18 to 20% of the home and community-based services. So if you've heard of a personal care attendant, someone that comes into your home that helps you live independently, maybe with preparing your home, cleaning, cooking, helping you do financial planning, that kind of thing. African Americans, Minnesotans of African Heritage make up about 18 to 20% of people receiving those services. But again, only about 7% of the demographics of Minnesota. So, and that's true for other marginalized communities as well. There is a significant overlap. And then the last thing I'll just let you all know about, is specifically as it relates to COVID, is that certain disability groups are up to 11 times or 10 times more likely to die from COVID than people who do not have disabilities, and about 4 times more likely to need hospitalization. And then now what's called quote unquote long COVID, or kind of that COVID that won't go away, or the after effects of COVID, are now a new disability category for people. We know COVID has also disproportionately affected communities of color as well. And so we expect that intersection of race and disability to only continue and not to only get more significant, I guess is how I'd say it. And I can go on and on and on, because this is what I do all day, but I don't know what time I'm at here, but I can also pause and turn over any questions. Okay. Well, the last thing I would say is that one of our initiatives at our council has been, so the disability rights, civil rights movement was largely modeled after the civil rights movement of the 1960s. Okay. So while the disability rights movement at the civil rights level nationally started about a little over 100 years ago, it wasn't really successful, to be honest, until after the civil rights movement that particularly in the Civil Rights Act, that era. After that is when the disability community basically modeled their activism after majorly the Black community's activism in the United States. But the disability rights movement has been predominantly led by white people, and that still is true today. And that is not representative, though, as I just mentioned, of the actual demographics of people with disabilities, right? So we have leaders, or we have people running organizations, agencies, myself included, to be honest, who are white folks leading this issue, but it's not serving the whole community and serving the whole state. So we have a problem. We have a problem at our agency, where we don't have enough employees of color. We have a problem at our council board. We are being very intentional about trying to recruit and retain more council members of diverse backgrounds. And this is not just race and ethnicity, also marginalized religious communities, LGBT people, across the board, being more integrated, more diverse in our work, because we know that we're missing lenses into our agency, whether that's at the staffing level or at the council board level. And so we have a few initiatives around that that we're working on. So I love working with Linda at CMAH and Sia at CAPM and Rosa at Latino Affairs, and kind of building up our kind of small agency civil rights groups. There's only a small handful of us, but we'd like to get together and share some of our challenges and frustrations working as a small agency in the state government designed for big agencies. Kind of an interesting experience. So maybe I'll just leave it there and open the floor for any questions you may have. So.
Well, first and foremost, and this is Chair Hughes speaking. So first and foremost, thank you, for being able to, come and give us a lot of good information. Happy National Disability Awareness Month. I think it was perfect when we were kind of, asking about different agencies to come. And so we were like, yeah, let's have them come in October, and then later realize perfect timing for you to come when this is the awareness month. One of the things that I would want to know is when you talked about 18 to 20%, is that community-based services, are those services necessarily prominent in a specific area across the state of Minnesota, or is it, kind of very similar to what I had asked Commissioner Herke? Because I think what we're finding is sometimes we focus so much on the Twin Cities, we forget about our greater Minnesota areas, and I see Councilmember Crawford has a question as well, but I'm just curious if you can answer that, and then Carl, feel free to ask your question afterwards.
Yeah, thank you. Thanks for having me, and thank you for a great question. So I would say, to be honest, the raw numbers are higher in the Twin Cities 7-county metro area, but there's a little bit of nuance there. So obviously there's just more people, right, that live in the Twin Cities. So it's not that surprising that there's more service recipients here, but they also have a hard time finding care providers in the Twin Cities. So the shortage issue, particularly among personal care attendants, but not exclusively, is a statewide issue. We just, meaning this last session, so this spring, got the legislature to approve a rate increase. So the amount that providers can get paid for and the amount that the actual employees get paid to provide support services, but it doesn't kick in right away, and there'll be some delays, but it still doesn't pay as much as working like at Walmart. It's really, so because of that, there's also high turnover, and not surprisingly, folks want and feel more comfortable with providers that are in very intimate parts of their life that may share the same cultural backgrounds that they do, right? So we have the Somali community really prefer people who are Somali to be their personal care attendants. Not surprisingly, the Asian community is the same way, same with the Black and African American community. They just feel that it requires a lot of trust to put your life and your independence in someone else's hand in some cases. And so getting retention, finding the right person, the right fit is very difficult in rural Minnesota. And then transportation is very difficult. That we have metro mobility in Minnesota in the Twin Cities only, which is kind of like a transportation service, and things like light rail and transit are cheaper, which is great. But if you're outside of the Twin Cities, very little of that exists, right? So there are definitely issues in rural Minnesota for folks with disabilities, absolutely. And that also, by the way, specifically on Indigenous territory lands as well. So.
Okay, thank you.
Yep.
Go ahead,
Well,
Carl.
Thank you very much for being here. Thank you, Madam Chair. My question is concerning African American people with disabilities and the way they are treated by law enforcement. Many times our young people are seen as much older than what they are, and their movements are misunderstood by law enforcement. How is the council working to educate law enforcement? I have a young man in my community who is nonverbal and is also deaf. So if the police were to try and stop him with their back turned to him, it could be a very dangerous situation. And I'll pause there. Thank you.
Yes, this is very serious, and it's a very real issue. There are so many settlement lawsuit claims because of this issue. So 2 or maybe 3 legislative sessions ago, might be 2, might have been 3, regardless, we were able to modify or increase some of the required training that police officers, or peace officers, I guess, are required to go through the post board. And that was specifically around autism. There are trainings that the state offers through its Department of Human Services, specifically to law enforcement, specifically to how to work with and in the community interact with deaf and hard of hearing people. That training is offered. We also offer training at a disability kind of generalist perspective as well. It's tough. I mean, we know that people with mental illness, severe and persistent mental illness, is considered a disability by the law. Not everyone, of course, with mental illness identifies as having a disability or as a disabled person, but it's protected under the same laws. So whether you have a mental illness or you are deaf, and my family is deaf, and so they see, people moving their hands. You're right that they typically will see Black individuals as older, possibly more assertive or more aggressive when they're having movements like sign language. It doesn't look like they don't expect it to be that they're trying to sign. They expect it to be something more negative, right? So there are these real issues, and honestly, we spent a lot of time thinking about this because we have had people get very seriously hurt. People have died, as you all know. I don't need to tell you that. And even the murder of Mr. Floyd, who was also a person with a disability. Obviously, the race played a huge part of that as well. So this is very pervasive, and so the disability community was in many of the marches and protests that took place as a result of that. The fixes, there's a couple levels to it. One is, honestly, it's a awareness and understanding about what disability and types of disabilities are. People are typically just have a lot of naivety. They're just not aware. They don't know. And so there's a lot of education that has to take place. But then there's also just a significant amount of attitude change that has to happen with peace officers and law enforcement. And I don't think that's something that we can legislatively change. Changing hearts and minds is a lot harder than changing a law or passing a bill. And I think that's actually probably the best way if we could do it. So in the meantime, we continue to push for required additional training, additional presentation, numbers of hours around these of continuing education. But if they're not receptive to the message that we want to find alternative methods of dispute resolution, we want to find ways to de-escalate situations, that someone could be having a seizure, they're not being violent. They could be, they could have autism and be experiencing significant sensory processing issues, and they look violent, they look upset, they look angry, but it is really nothing to do with anything criminal or involving law enforcement. If they're not open to those kind of conversations and to those realities, actually, then I don't think it matters how much training we give them. It's just going to clock their hours and then pass. So it's really a social thing of getting people to see law enforcement, to see them as people, as full people. And unfortunately, that's not something that's easily changed. So I wish I had a better answer. In Minnesota, it's about 1/5 of the population has a disability. So it's a huge demographic, but it doesn't get a lot of attention, let's say, in terms of being a demographic. So, but when you overlap race with disability, some of the education outcomes, health disparities, law enforcement, there are compounded and they're not good.
Thank you. Thank you.
Any other questions? Otherwise, I know, Carl, you have one other question. But I wanted to just give an opportunity if anybody else had a question for David.
Yeah, this is Jude. Thank you, David. In a Black community, especially immigrant community, sometimes there's a stigma associated with disability, and families tend to not open up or seek for help. I know you have some programs and outreach, but is there any specific things that the CMAH can partner with you, and also some outreach to community organizations to help your work and bring it to the community, and also talk about stigma and how they can open up to, because it's all about help. You know, when somebody needs help, they have to have it, especially children or people who need help, who can't decide by themselves. So is there any way we can support your work and some of the programs that can come to the community and help promote what you're doing?
Yeah, thank you, Jude. That's a fantastic question. And you're right. So for many immigrant communities, whether they're of African heritage, this is also true of Asian heritage communities, families are often, I'll just be honest about it, oftentimes they're embarrassed, or it's considered shameful in their place of origin to have someone with a disability as their children. So they hide them at home, and they don't get the special education supports they need. They don't get the medical care they need. They don't get the communication access or mobility, maybe like a wheelchair or various types of mobility supports that are out there. They don't get them because that's what they're used to from their country of origin when they immigrate to the United States. There's also an issue about in certain cultures admitting that they need help or trusting that government supports will help them because they've experienced a lot of negative trauma with governments basically traumatizing their constituents, their citizens. So, to say, well, no, go to the government to get help makes no sense at all to them. So right now we're working with the Afghan refugee resettlements that are coming, right? Most of them are the former interpreters for the armed forces in Afghanistan. And many of them have trauma and missing limbs and disabilities as a result of being in a war area, right? But getting that shift is a big deal. And, it causes homelessness. It causes, it means that there's even worse educational outcomes, worse health outcomes. So absolutely, there's a significant lack of culturally affirmative disability services. Almost all of it is neutral and general, which means it's typically designed and created by white people, to be honest with you. Not necessarily, but almost entirely that way. And the systems that we use, the county systems and the state, are not easy to navigate, especially if you need someone to advocate for you or you need to self-advocate. That's also a skill that people don't always have, especially from the immigrant communities where they come to the United States. They don't know all of their rights. They don't know all of the services that are available to them. They don't know that they're able to appeal at things or say, no, I don't think that's right for me. I think I should do this instead, or my child should get this instead. That process of conversation and in compromise, they just assume that person's making the decision in their best interest, or that that's the right solution for their family or for their child. All of those things are all a part of the immigrant experience that I've only heard about. I can't speak to myself as not an immigrant, but I hear about a lot. And so this is in the council and the work that we do, it is very difficult to find the communities of color and the pockets of groups of people with disabilities in those groups. So we know of one group called the Black Deaf Advocates. They are a Twin Cities-based nonprofit advocacy group that is just about the signing American Sign Language, culturally deaf people of any African heritage or identify as Black. And then there's the Multicultural Autism Awareness Network, which is not Black specific, but includes many ethnicities, and Somali and certain other parts of Africa are significantly represented in their work. We have one group that works with a specific group of the Asian community, but like that's really it. And then we have like 75 other groups that don't do any of that. So we're missing that intersection of those culturally affirmative. We need service providers that look like the people that need support. So we're missing special education teachers that are teachers of color. We're missing therapists and speech therapists and occupational therapists that we know that when people have teachers or support providers that are role models or that can identify and relate to the people that they're teaching or that they're serving, that those kids will do better. And we're missing that big time in our community. So absolutely, yeah, that's one of the areas that we're slowly trying to build our bridges here with with Linda and the other executive directors, is seeing where, because we miss a lot of that cultural ethnic lens, and we feel like there may be some spaces where the council, such as your own, might be thinking of diversity and inclusion really just at the race and ethnicity level, and missing some of the disability aspect of what it means to be inclusive and diverse, and how we can collaborate. Absolutely, it's something we'd want to do.
Thank you.
Yeah, great question, Jude. Thank you.
Carl, you can go ahead and ask your last question.
Thank you, Madam Chair. David, thank you for being here tonight. The last thing is more of an opportunity to work together. We are challenged in Duluth by not having vehicles, Uber and Lyft, that can accommodate folks with disabilities, as well as our vacation rentals. And because of the new laws, those industries are not mandated like some of the other industries are to follow those rules. So I will be in touch, hopefully through our executive director, Linda Sloan, to work with you if you are working on things in the cities that can come to the rural areas to deal with that issue. Thank you.
Yeah, I can briefly mention two things, and then I'd be happy to take this offline and go deeper. One is we're on the Connected and Automated Vehicles Task Force with the Department of Transportation, because we believe that if we were able to have more automated, driverless vehicles, that would be a huge support infrastructure and transportation opportunity for folks with disabilities in rural parts of the state, particularly where there's less infrastructure, like you mentioned, Carl. Yes. But yes, Lyft and Uber are not required to have accessible cars like taxi companies are required to. So it's a significant oversight, and we have tried a few times to pass a law that would require, they're called transportation network companies, TNCs, but Lyft and Uber basically, to require them to provide accessible, mainly wheelchair accessible. That's not exclusively, but that's the main issue. And they just lobby hard, particularly Uber, lobby hard against that requirement. So we are working on it. I'd be happy to build a stronger coalition around that, because we think that if we can get those TNCs, those Lyfts and Ubers that do those transportation on demand right when you need it, because right now folks with disabilities have to plan out days or weeks in advance, ask friends, call, try to work things out. They don't have the privilege of just saying, hey, I want to go to the airport, call in the morning, and I can just go off and go. They're missing that, and that's even worse in rural, Minnesota. So we think that would be a huge improvement to transportation access for people. So accessible Lyft and Uber is one of our actual primary issues that we're hoping to get on our agenda this legislative session in the spring. Council approval pending. So.
And it ties directly into your employment issues where folks can't get to work.
Absolutely, that's right. It's all connected. Yes, thank you.
Well, David, thank you so much. This is Chair Hughes speaking, because I know you want to make sure that it picks up the transcription. Not a problem. So definitely appreciate you coming and bringing this wealth of information. Again, spending your evening that I know you didn't have to spend, with us, but it's so appreciated. And then I'm sure, Linda will follow up, as well as some of the other council members will follow up with you. So thank you so much for coming, and have a great evening.
Yeah, my pleasure. Honestly, I love meeting with everyone. The opportunity is really my honor. So thank you for reaching out to me and inviting me. And thanks to, I think it was Shakira. Sorry if it was someone else, but and then also Linda and Chair and the council, everyone, for giving me, I think, way more time than I was supposed to. So I appreciate it. Thank you. All right, have a nice evening, everyone.
Thank you too. Bye-bye.
Bye.
So we will head forward with our agenda. I don't believe we have any community members on. Is that correct, Shakira? I think it just might be us.
Yep, that's correct.
Okay, so I'm going to move forward with our agenda. So special bulletins. So we had spoken a while back with some of these, some of the presentations that we've had since last year, and what we actually are looking at doing. And we said we would submit a special bulletin. So as you know, right now there is a council bulletin that comes out. So hopefully everybody's receiving that council bulletin. But we had said, because there were several people that had talked about what's the follow-up, or maybe they've missed the meeting, and so they wanted to be able to review the meeting if possible. So last week when the executive team met, we said that we would give at least until the end of the year, the calendar year, to send out a special bulletin that kind of talks about who we've had, what month we've had them, and then the link if public members or even members of the council that missed some of the early on conversations would like to review that. So we want to make sure that that is done. Any questions about the special bulletin? All right. So secretary position discussion. So as you know, we had Tawana Mullins was actually in that role. The council had opted and voted, I'll say that, on a council meeting that she was not able to attend. Let me preface that. And they were like, oh, I think it was moved and seconded that that she continue on. And after speaking with her, she actually has opted not to continue as serving as secretary. So Vice Chair Doe has graciously volunteered that he is going to make some phone calls to everyone and to encourage them to consider just tentatively stepping in. What we would actually be looking for is somebody to temporarily step in as the secretary. And then in June, when we have our June meeting, then we would actually vote. We change the voting that every other fiscal year we would have elections on specific positions. And so this upcoming year, it would be treasurer and chair. And so we actually will have treasurer, chair, and secretary. So we would just need somebody to step in tentatively from now, which would be November until November through June. And then June, we would have elections. So he will be making some phone calls. Just real quick, if you have an interest, please let Shakira know. If you have an interest in saying, hey, I wouldn't mind stepping in just temporarily for these next few months. It's not a lot of work. Let me just tell you that. It really is, in addition to the full council meeting, yes, you would have an additional meeting, but we always meet the week prior to the council meeting. So it's really twice a month. And then the other caveat is right now, our office manager is taking the notes. So what she does is when she's done, she would send it to the secretary, you proof it to ensure that everything was captured, if there's no errors, and then you kind of send it back to her. I mean, so that's kind of the extent of that meeting, but then also kind of tracking pertinent, dates and stuff that might have been missed as far as what we said we're going to do, whether it's an event or whether it's a date that we absolutely need to note because of something that's going on in the community. That's probably the extent of that. So I will stop there to see if there's any questions in reference to that, or if anybody wants to raise their hand now and say, I wouldn't mind doing it. All right, we'll keep going. Y'all are quiet tonight. So new business, you all should have been, you were sent out in the packet, NECA Creative contract. We need to vote on that contract today. What she is actually going to be doing is she's going to be, again, bringing her on for our annual report. As you all are aware, she did the report last year. We got rave reviews. She did a phenomenal job. So absolutely, it makes sense for us to continue on and use her again this year. So hopefully everybody has had an opportunity to review the contract. Linda, I'm just going to kind of put you on the spot if there's any highlights of the contract that you want to note for the council before we move it to a motion to vote.
Madam Chair, I think you so eloquently stated that NECA, they provided an amazing product. The contract is really on par with the amount of spending from last year. And frankly, I also have a marketing background, and they could have really charged us some more money. So I think that we're getting a great deal. They're an amazing partner, and I would definitely like to work with them again this year.
Any questions in reference to the contract that anybody has?
Well, no question, but I just want to add that, yes, the work that they did in the past, last year was phenomenal. So, and I agree, for the amount that we have, it will be a good relationship that we're building with them. So
with that, Wayne, you want to put a motion out there?
Therefore, I move that we vote on the contract and accept the contract as it is.
Is there a second?
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Any abstentions? Motion carries. Thank you all. For the community presentations, this was really just one of the things that we wanted to talk about was the process. We absolutely want to have you all invite communities to come to present to the council, but there has to be a process that, as you all are talking to these community-based organizations or even other nonprofits, is the idea would be if you're having the relationship, you would introduce them to the executive director, let Linda have the conversation, and then what Linda does is kind of we meet almost weekly, and then she would bring that to my attention, and then we can get it added to the agenda. But what we don't want to have happen is we have the conversation to a community-based organization, and then we tell them, oh yeah, we'll get you on the agenda. That's not quite how it works. And so I just want to make sure that, we understand that, yes, we still want community presentations, but there has to be a process of which how we allow them to come and be able to present whatever items that they're going to present, because there should be at least a conversation with staff before we kind of move forward. So I just wanted to bring that up because we have been talking about that for a while. And I just wanted to make sure that if there were specific organizations that you all wanted to have come present to the council, then at least you kind of knew the process is, reach out to Linda or make the connection with Linda and Shakira, I should say, because Shakira really would be able to say, hey, here's a good time to meet. And then it's brought then to the executive committee and added to the agenda for us to decide, let's have them come this date or have them come that date based off of the topic that they're wanting to bring to us. Any questions or comments in reference to that?
So question, you're saying we should we should contact whoever will be doing the presentation for that person to contact Linda or Shakira, or should we give the names to the staff and they contact the individual?
If it's a personal connection, I would say make the introduction.
Okay, just make the introduction.
Make the introduction, send an email and say, hey, I've CC the executive director and the office manager on this email communication, and then they can follow back up, with that individual, or tell that individual, now that they have their information, they can follow back up with them.
Right, okay, yeah.
What we don't want to have happen is, and it did happen, where I didn't know anything about it, and then all of a sudden I was brought into the conversation kind of after the fact. So we kind of want to make sure that the staff kind of have an idea, because they're the ones that are directly doing the day in, day out work. And so we may think that it's a great connection, but then they'll be able to link it and align it to some of the work that they're doing, and possibly open it up for other opportunities for them to work together and not just come and present. So that's why I just think the connection needs to happen. And we talked about this last week in our executive committee, to say it just makes sense so that everybody's clear when you're doing an introduction, then what realm should you be doing that in? If that makes sense to everybody. Okay. Any other questions or comments? All right, Linda, I'm going to turn it over to you because you have the remainder of the meeting.
Thank you, Madam Chair. As you know, we have a new template that we are trying out in terms of providing a report prior to the meeting with just some quick highlights and updates. As I'm sure that you guys are aware, just in your own natural work, you can't put down everything that you do. You can't document every time you get a call or somebody asks you to do something. So these are just mainly a few things that we've been working on, and listing some opportunities, as well as if there's some things that we would love for you to work on. So in terms of the work that I've been doing, as you know, as a director, there's always HR items that need to be done. So I've been working on the staff performance reviews. It's that time of the year. This month, actually the end of last month, I testified at a redistricting mapping hearing, and that was something that was brought to us by an organization called Common Cause, and we'll also be doing a mapping event with them. But the importance of the redistricting is that we need to make sure that we are represented, that our vote matters. And in order to do that, the district lines have to be drawn fairly. So we're heavily engaged in that. Theo has partnered with me on that and actually helped write some of my testimony. So I was able to do that, and we'll have subsequent testimony coming up shortly. As you know, Amber is gone. I'm going to keep saying that. I love her so much, but she's gone on and she's doing great work on the governor's staff as a policy advisor. We are engaged in the hiring process, and I'd like to thank Council Member Crawford for offering to be a part of the interview team. So we have gotten some candidates, not a ton of candidates. I think maybe about 11 candidates, and we've identified 3 candidates that we will be phone screening and then hopefully potentially bringing in for interviews. So that's coming up fairly quickly. We worked on our strategic planning, and so that'll be coming to you probably next month, just in terms of what are the goals for our specific staff. We have some strategic planning items that you guys had done prior to my arrival. So we're trying to mesh that so that the work that we're doing actually relates to the work that was identified in the previous strategic plan. So that will be coming up soon for you guys to review. And then I have been working on a predatory sex offender task force, which meets every week. So we have a couple meetings every week, and then there's work group, smaller work group meetings. So I've been doing that. So those are just a few things that I'm engaged in terms of marketing. There's some programming, which normally would fall on the outreach person, but because we don't have one, I'm pitching in for that. But again, working with Al McFarland and Attorney General Ellison, trying to actually nail those programming opportunities down. So it looks like with Al McFarland, who is with Inside News, we'll be doing a couple of events with the Afro-Latino community. So if you have any good contacts in that African Heritage group, let me know, because we'll be doing some panel sessions and just trying to be more inclusive. Still trying to get the immigrant one off the board. Right now, I'm just waiting for a couple people to get back to me with their time, the times that they are available. Really want to move that one forward. So if you're interested in that, send me your availability. I got a couple people who have said yes, and just want to make sure that they get back to me on that. Let's see, just a couple things that I wrote down as we kind of went through the meeting. Just a reminder that we do still have that one council seat that is open, and they will be moving on that probably within the next couple of months. Normally this is done yearly, but because it was so close with the timing for when they released and identified the other individuals who would come on board, now they're going to just go ahead and try to move forward with that. So last call, if you have friends or you know of some people who would be amazing on the board, we'd love to get their application in. Then the other thing is the governor's staff contacted me. They are trying to pull together an event calendar. So if there are events that they should be aware of, whether or not you want them to participate or you want them to just be on the calendar, please let me know, and let me know as soon as possible regarding that. And just again, action items. Theo can probably talk a little bit more about the redistricting session and what we need. Shakira handed out an interest survey about, well, it went out initially about 2 months ago. We reworked it because our Madam Chair had a few questions that she wanted to know, but we really would love for you to fill that out, because we want you to be engaged in the council work. We want you to work on things that you are passionate about. You got on the board for a reason. So if you can fill that out, we can match you up with what we're doing. We promise you, we won't create a lot of work for you, but we want you, we want you to feel like, hey, I'm on this board, I'm on this council, and I feel good about the work that we're doing. I feel good about the work that I'm doing and participating. So please fill that out. And then the issue survey as well. And Theo will talk a little bit about the survey probably within his report that Femi is working on. And just the last thing, the expungement fair, still working on that. So Femi will get back to you. He couldn't make it today. So thank you. That's it for my report today.
Any questions for Linda before she moves on? All right. Theo, you're up. You're muted, Theo.
Thank you. Good evening, everybody. So the highlights on the legislative work in September, high level key work that we did, the Crown Act. We met with the governor's office and the Human Rights Department to plan advocacy efforts around the Crown Act. The bill clarifies our state's, or seeks to clarify our state's human rights law to protect against hair discrimination. It's really a national movement for this legislation in different states, and so we're really going to work hard to try to get this passed in the next session in 2022. The Human Rights Department is a key partner in the work, and the governor's office is also committed to it. I think one of the things for community, if you have any experience with discrimination or issues regarding your hair, whether it be at work or at school, stories and anecdotes, personal experiences like that, please come forward. Those would be really good to provide at public hearings, or whether it be orally or through written testimony. So that's a key initiative moving forward. Another area, the jobs, labor area issues around economic development. We had meetings with the Department of Labor and also DEED and Employment and Economic Development, discussing policy ideas for the next year. Another key initiative, as Linda mentioned, is the redistricting. So I supported Linda with content and research for the testimony at the House hearing on redistricting. We just a little background. So every 10 years, our state does a redistricting process, and basically where we redraw the district maps for our elected officials. So we have House districts and large Senate districts and smaller House districts. And those maps get redrawn based on data from our census, our national census. And a key sort of aspect of this is, from our own standpoint, as CMAH, is to ensure that the redrawing process and the final maps that get redrawn, that our community's voice, that it amplifies our community voice. It amplifies what we call CMAH power, right? Our CMAH power, really the voice and interest of our community in our electoral maps, in our district maps, and in order for us to actually deal with the kinds of issues that we have to deal with the challenge that we deal with as a community. Through policy. So that redistricting process is really important. There's a legislative component to it, which is what we have been engaged with thus far. In September, the House had hearings that we testified in. The Senate also has hearings. And then there's actually a separate special process that has been that's been led by the Supreme Court. So the Supreme Court has appointed a special panel on redistricting, and just because there are various reasons for that. But I think a key part of that is that the anticipation that the House and the Senate, there might be some roadblocks to actually getting things done by specific deadlines next year. So engage in both of those channels, those processes of our redistricting is really, really important for our community. Another key project for us in September was legislative training. Developed and provided a legislative process 101 training session for community members. And then in terms of opportunities, again, the need for community input, participation of African heritage stakeholders in our state's redistricting process. One of the things that we are going to do as CMAH to contribute to help that is we're going to partner with an organization, Common Cause, I'm sorry, names skip me. Common Cause, a very good resource for us on doing really good democracy work in the community, democracy advocacy, and they will be leading a workshop for community members, and definitely looking forward to board members who can participate in this to do a community mapping workshop, and though the data from that can then be used to contribute to the community, to the redistricting processes. Also, you can submit oral and written testimony at the legislative hearings. So there's always call for input by the House and the Senate in these processes and at public hearings. And so please be on the lookout for those. Another opportunity, this is just good information. The legislature will reconvene late January 2022 or early February, but it's probably going to be the last day of January next year that the legislature will reconvene for regular session. So at this stage, in the fall months, we're sort of in policy development season. So local, regional, and state agencies are developing their legislative priorities for the 2022 session. It's a good time. This is just for community members to know that this is a good time to engage your public officials, particularly your elected representatives, to engage them in specific legislative ideas or proposals. Reach out to them about community problems that you think could be addressed through policy, because this is the time when they're coming up with some of those priorities that they will introduce when the session begins. So that's just a really good information for the community to keep in mind. And then finally, in terms of action items, again, we'll have more information about a date for the community mapping workshop. And then the big thing is that we have our community survey that will be released shortly, and just be on the lookout for that in our bulletin and our social media. And we definitely look forward to sharing that with the community and letting go as far as possible around the state. So I'll hold for questions.
Questions for Theo? So let me just reiterate, the survey that I'm getting feedback. Hold on. Okay, so I want to reiterate the survey that Linda brought up, and then also if you can participate in the redistricting process. I mean, I think that would be good if you all are available to do something like that. I know I was sent something from Anika Robbins, and I did fill it out, and I know it's a part of that same thing. So I did, participate in that. But this is all a part of the work of serving, on the council, is these additional aspects that may come up that we should really get engaged with, or either get more information about, so that we can elevate some of these things, a little bit higher. So I just want to kind of just echo some of the things that have already been said. So Shakira, you are, go ahead, Wayne. Go ahead, Wayne.
No, I want to add, because I did do the survey. My question is it primarily just us doing the survey now? Is it already public, or you're getting feedback from us in terms of how we feel about it, or any suggestions? So, I mean, is it public now, or would you know that if I did the survey? Are you aware, or how does that work? What's that process look like?
We have, I think, Linda, you want to answer that question in terms of the release?
Yeah, so the survey is anonymous and it is ready to roll, and we're just doing the last final checks. You got to check spelling, you got to make sure all the links are working and all that. So we did request feedback, but if you have some feedback, we were ready to roll today, but Femi had class, and so he wasn't able to be available. But we're planning to roll that out tomorrow. However, if you have something, especially if it's something that is an error, please let us know tonight, or send us something first thing in the morning, so that we can make the change. So if you do have feedback, first thing tomorrow morning would be, the last opportunity to do that. But we are ready to roll it out to the general public.
I mean, that sounds good, because I went through it. It was seamless. The questions were great. I was able to go through it. Yeah, so that's good. Thank you.
And we will be contacting you to help us distribute it, because that's going to be a key thing. We need people to fill it out. So we'll be sending it to you for you to send to your friends and your organizations and asking them. That data is so critical, because we want to take the data, analyze it, and then connect with the legislators and say, hey, here's what our people are concerned about. Here's what you need to focus on. So it's our hope that we can work with the Black legislators to help drive some of this change that's required.
Any other questions before we have Shakira give her update? All right, Shakira, you are up.
Okay, so for my update, I'm going to keep it really brief. A lot of what I had there has already been covered, so I'll just briefly go through it super quick. For the oral history project, we are still on track to have that completed by December. I did meet with Jeremiah late last month. I'll meet with him again at the end of this month just to confirm where he's at, to make sure he's still on track with that. He's completed one email with Steve Belton. He's got one interview with Steve Belton. He's got one meeting scheduled for who we met last week with Al McFarland to be interviewed as well. So those two have been interviewed. So we have 10 more interviews to be done. We have 12 interviews total. I gave him information on other avenues and other people to contact because he was having some issues with getting contact information for people. He is still working on getting an interview with Claude Washington from Duluth. He was one of the council members during the 80s. He was unable to get a hold of Melanie Miles, who was a liaison between the council and the Minnesota Department of Rights during, I believe it was during the 90s was when she was there. So that's my update for oral history. I'll have more at the next council meeting. He should have a couple more interviews under the belt then. For the special bulletin, I know it was briefly covered, just to know like where I'm at with it. I'm still going through getting timestamps on things, making it more easily accessible for our community members to be able to know, okay, well, at the April meeting, there was the Department of Education, both OHE and K through 12. So they know, okay, well, my child's K through 12. I know if I go to this timestamp, that's that presentation. I know my child's in college. I go that timestamp, that's that presentation. So they don't have to try to go through a whole 2-hour recording. I have gotten everything done back through November. I'm on track to have that finished so that I can go out with one of our December bulletins and kind of do like a yearly wrap up. For Day on the Hill prep, we know that is coming around the corner. Right now, we're thinking we might maybe be able to do a hybrid version. So we reserved the rotunda for the 25th from 1 to 3 p.m. And that is contingent upon us being able to do a hybrid program and the state capitol building being open. If for some reason that building is still shut down, the reservation will be canceled, and any funds that we would have to pay them would then be reverted back to us. And that is pretty much my update. Yeah. Any questions?
No, thank you for that. And I was going to say, if there are specific people that we're running into that you can't get a hold of, maybe reach out to the council members to see if they have any connections for current contact as Jeremiah is, making his rounds. Mm-hmm. Just keep that in mind too.
Yeah, definitely. It looks like Carl has some insight onto Claude, so I will be reaching out to him about that interview.
Perfect. All right. Thank you. Any questions for Shakira? Are there any announcements? All right. Well, with that, I'm going to give you all a little bit of time back. I can have a motion to adjourn.
So moved. Crawford.
All right. So look, Carl motion, Tawana second. Discussion, all in favor.
Aye.
Aye.
All right.
Aye.
We are officially adjourned. Thank you all. Have a good night.
Thank you all. Stay well.
Yeah, take care.